Hello, everyone. Can you hear me? Okay.
We can hear you.
Okay. We'll go ahead and give it one more minute, and then we're going to get started. But I want to thank you all for joining us. Okay, we're going to go ahead and get started since it is 2:02 according to my phone. Well, thank you everyone for attending our COVID-19 Zoom seminar. You know, since the pandemic has started, Caridad has made it a priority to join the fight against COVID-19 for our community and the people we serve. As one of the leading organizations in Palm Beach County with providing services during COVID-19, the leadership at Caridad wanted to provide this free seminar for our valued supporters. There's no bigger topic or issue affecting us all today than COVID-19. And we are very excited to have three excellent speakers who will provide some insights into this pandemic. And to start things off, I want to introduce Dr. Mario Giacomino, who will be introducing our first speaker. Dr. Giacomino is with FAU Schmidt Medical School. He is a volunteer doctor at Caridad Center. Dr. Giacomino helps coordinate the valued partnership FAU Medical School has with Caridad Center. FAU brings in medical students into the clinic to volunteer and to help service our patients. Dr. Giacomino also serves on the board of directors for Caridad and was instrumental in organizing this event today. Please welcome Dr. Giacomino, who will be introducing our first keynote speaker, Dr. Adram.
Thank you, Scott. Not sure I can start my video, but first I want to say welcome to everybody to this webinar. Scott mentioned on my board of the Caridad Clinic, and he asked me to see if I know a few experts in the area to be able to talk to them. And I said, absolutely, yes. I know two excellent people, and it's my pleasure to introduce the first speaker, Dr. Terry Adram, who is a professor of pediatric here at the Charles H. Smith College of Medicine at Florida Atlantic University. Dr. Adram has a lot of responsibilities here. One of them is to be the chair of the Department of Integrated Medical Science. In that role, she provides leadership for a department comprised of about 80 faculty, 1,000 affiliate faculty members, and that includes all kinds of specialties in medicine. Besides that, she has a significant role as a Senior Associate Dean of Clinical Affairs here at the Charles H. Smith College of Medicine. In that capacity, she provides the oversight and the leadership for the College of Medicine clinical enterprise, and including patient care, the clinical translation research, and the faculty clinic that we started recently. Dr. Adram is a pediatrician. She got her MD degree from the University of Miami, Miller College of Medicine, and a residency in pediatrics from Children's Hospital of Philadelphia in Pennsylvania, and followed by a pediatric emergency room fellowship training at the Children's National Hospital in Washington, D.C. She also had a primary care sports medicine training at the DeWitt Army Community Hospital in Fort Belvoir in Virginia. Dr. Adram, before coming to FAU, she was the Principal Deputy Assistant Secretary for the Defense of Health Affairs in the Department of Defense. She has a Master of Public Health, and she has very accomplished in the area of research and public health with over 200 publications and oral presentations. And she has been a keynote speaker for several engagements. I was present in one of her presentations at the Palm Beach Medical Society, and I thought that she was such an engaging speaker that I asked her to be here with us and to share her knowledge. It's my pleasure to introduce Dr. Adriana. Thanks very much for being here today with us.
All right, terrific. Can you all see my screen?
Yes.
Awesome, did this right. Figure after about 8 or 9 months of this, finally get it right. So thank you, Dr. Giacomino, for that really too long introduction. I greatly appreciate it. I want to thank you and the Caridad Center for inviting me to come here and speak to you a little bit about the pandemic. It's a privilege to be asked. And what I plan to do is to just talk very briefly, what we like to call the wave tops, or just very superficially, you know, with the most up-to-date information about the pandemic. And it'd be remiss if I didn't thank all of the clinicians who are caring for our patients. This has really been a very tough last several months, I think, for all of us, not just those who are on the front lines in the ERs and critical care, but also our primary care providers and everyone during this time. It's just been really tough. So thank you all for all that you've done. So I thought what I would do is I would just very briefly dive into the data, the most up-to-date data. Everybody reads the newspaper and watches the news, so I think you all have some idea of what's going on. And then just talk a little bit about some up-to-date information about tests and therapeutics and vaccines, and then turn it over for questions. So this first slide here is from the COVID tracking project, and it's national data. And what I want to draw your attention to is if you look at the red chart, you could see that back in March and April, we had a surge in cases when the pandemic first hit. We then had an even bigger surge over the summer, which we in Florida were a part of. But what you should note is that the number of cases per capita, or the number of daily cases in the United States, just never, you know, went down to even where we were as a peak in the first surge during the spring. So we are now starting a third surge at a really bad place right now. And if you look on the chart on the right, the blue chart, you could see, these are hospitalizations in the United States. You could see that one, we've increased about 46% over the last couple of weeks with regard to hospitalizations. So no matter what anybody says, it's not because we're testing more. But here too, we also never really hit a low plateau like they did in other countries around the world. And then lastly, I have a chart here on the bottom on US deaths. And as you all are aware, you see a surge in cases. Sometime after that, you see a surge in hospitalizations. And it's somewhere down the line where you see an increase in deaths. But as you can tell, even during the second surge over the summer, we never hit the peak number of deaths that we saw in the spring. And there's a multitude of reasons why that is, as you all are likely aware. Number one, we've gotten a little bit better at treating the infection, especially the serious infections, though we don't have a really, you know, gold standard therapy. We don't have a vaccine, but we are treating it better in hospital, but also it's affecting different age groups, which are less likely to be sick. And back in the spring, it really affected our elderly population, with the average age being in the middle 50s. So this next chart, I'm not going to belabor, but it's from the Institute for Health Metrics and Evaluation out at University of Washington, which is the one that the White House cites and had been cited a lot for their disease modeling and their projections. And the only point I want to make here is that if we are on the same course where we as a nation don't do any more than what we're doing now, which is not enough, that we're on target by early next year to hit almost 400,000 COVID-19 deaths. And what you could see on the right-hand side of the chart is they apply different scenarios to their modeling, and that if we continue to ease restrictions, we're going to go well over 400,000 and head into the 500,000 number of deaths. So this is something that's very scary to all of us who do public health. So let's drill down a little bit into Florida. And this is hot off the press. Took it off the Department of Health website this morning and made this chart. It's the number of COVID-19 cases through yesterday. And there's a couple of points I want to make about this chart. One, if you look over on the left, you could see the first surge and look, at how low that surge looks compared to the surge that we experienced over the summer. And as you can tell, mirroring what we saw nationally, we never hit a plateau that was below the peak of what we saw in the spring. So we are starting a third surge now. You can see over on the right-hand part of the chart. If the scale was a little different, you would see a little more of an uptick. But we are seeing an increase of cases. This is a 7-day running average chart. So this increase in cases is real. Last week, at the 15% is really for last week, we saw an increase of about 15% in the state of Florida. And if we come down to Palm Beach County, what you can see here, and I circled it in red, is we really are starting to see an increase in the number of our cases. So now I want to drill down a little bit differently into the data, because this was something that I had a big interest in over the summer, uncovered some really interesting, not good, really bad, actually tragic findings for our local community. But let's start with national data. And this is, again, hot off the press from the CDC. I think I took this off their site yesterday. But what this shows is the disparities in cases and deaths for Blacks and Hispanics primarily. So if you look on the chart on the left, what you see here is, and it's only about half the cases that are reported, but even with those half of cases in the United States reported, we're seeing that Hispanics, 27% of cases are Hispanic and 16% are Black. But if you look at deaths, that's where you really see the disparities. And for Hispanics, 38% of the deaths in the age group of 30 to 39, and the chart below is age 40 to 49, that's 39.6%. So we see a huge disparity there in deaths for Hispanics. And we also see a disparity for Blacks, perhaps not as much as Hispanics, but still an overrepresentation in deaths of Blacks. In 30 to 39 age group, 28% of the deaths are Blacks. And in the 40 to 49 age group, it's about 29% are Blacks. And if you recall that Blacks are 13% of the population, Hispanics 18%. So from a national standpoint, and you've, I'm sure, seen this in the news, that that deaths are really affecting our Black and Hispanic populations more. So some of the findings that I found this summer, and it was really kind of shocking, I was asked to look at some medical examiner data for other purposes. And that purpose to me was irrelevant, because one of the things that I found in looking at this data was data that was to about early July, that 90% of the people in Palm Beach County who died from COVID were Black or Hispanic in the 20 to 49 age group. And that to me was shocking. 87% of people in the 50 to 59 year age group. And that gets less as you increase in age, and then it becomes what the population is over 69. So what that tells me, or tells us, is that it's the working age group, those people who are disproportionately represented, perhaps in frontline work, who are being affected. They have a higher number of cases, and they're suffering the effects of the disease more. And it did over the summer receive some news coverage, but that is really just shocking. I'm currently doing some analytics now for after the second wave, but I fully expect that that disparity will exist. So now I'm going to turn to a little bit about testing, just a couple of points that I want to make here. There are 3 different kinds of tests, as you all are aware. There's the PCR test, which is the test everybody knows. Classically, it's the swab that goes far back, practically up to your brain. And it's a test that goes to a lab, and it takes anywhere from 24 hours. And during the peak, the second surge over the summer, up to 10 to 14 days. And these tests, while they're not the gold standard, certainly culture would be considered the gold standard, but it is the test that is perhaps the most accurate. But even with this test, we still see 12 to 30% false negatives, or that it has a low sensitivity. The thought is that it's largely due to technique, the fact that it has to be transported in a certain way, but it's still the best test that we have. We also have seen a rise since the spring in antigen tests. A lot more have gotten emergency use authorizations from the Food and Drug Administration. And these tests are really important. I kind of liken it to being able to do a rapid strep test and then you send your swab for culture. You really want to know right away for COVID. And so having an antigen quick test done in less than 15 minutes is really helpful. However, these tests have lower sensitivity than the PCR, meaning higher false negative tests, but they are rapid and cheap. And it's my opinion that anyone who gets an antigen test that's negative, it should be sent for a PCR. And then there are serology tests. I think that there's a lot more clarity about the utility of serology tests. Early on, people were doing them thinking they can do them for active infection. As you know, it's really a test for post-infection. Early on, there were, you didn't have to have an authorization, emergency use authorization. So everybody was calling out of the woodwork to say they had a serology test. The federal government then got a handle on it and said it had to be under an emergency use authorization, and you had to demonstrate a certain level of sensitivity and specificity. So there's probably by now more than 20 antibody tests. Still likely high false positives because in our population, we're not seeing probably any more than 10 to 15% of people have been infected. It's really still being used for seroprevalence studies and for convalescent plasma donation. I think we know better now that the virus does induce likely protective antibodies, but we still don't have clarity yet on how much of those antibodies you need in order to be protected, how long they last. So I think every day more and more evidence is coming out in this arena. A little bit of an update on therapeutics. I looked it up as of October 25th. There were greater than 3,500 research trials for COVID-19. You can look this stuff up under clinicaltrials.gov. It's public information. And the point that I want to make here, and I think you know this by now, there's been a few really good randomized control trials, both looking at prevention of infection as well as treatment of infection for hydrochloroquine, and it's not a treatment. Nobody should be using it. Has not been shown to be effective. We wasted a lot of time on that. There are some studies about remdesivir. As of this week, it's still a little bit controversial. There were some studies, good studies, that showed that while it didn't reduce mortality, it did reduce the length of stay and hospitalization, which certainly is worthwhile. But then there's been a subsequent study just the last week or so, which said it does neither. So I think it's something that is being used in hospitals, should still probably be used. It is under an EUA, but there's still research going on. We also know that dexamethasone works for hospitalized patients. Convalescent serum is controversial theoretically, and in other diseases it's been shown to be effective, but it hasn't yet been shown to be effective as a treatment for people with COVID. One of the treatments that has really good promise but hasn't yet been really proven yet, but hopefully will be soon, are monoclonal antibodies. If you recall, the president got, I believe, a polyclonal antibody under compassionate use. Hopefully we'll know soon whether this is an effective treatment. And then other types of medications, a whole bunch of them, IL-6 blockers and others are under study, but they haven't yet been shown to be effective. With regard to vaccines, there's a huge number of vaccines being researched. Less than about 12 are undergoing human trials right now. And the reason why it takes so long is because there are so many steps that a vaccine developer has to go through before you get to the clinical trials. And then the clinical trials take a long time, as you can see here on this slide. And then once you get to phase 3, it takes a good amount of time in order to look at the data and to ensure that a vaccine is safe and effective. I think, you know, the FDA has really gotten a handle on this. The committee just met to review the data to determine safety and efficacy of some of the leading candidates. I'm hopeful that we'll have something in early 2021, but understand that this is a novel new virus, which makes it even harder to come up with a vaccine. And once we do have a vaccine, you know, the leading candidates, you need two doses, which makes it logistically even harder to get everybody immunized. And then at that point, you have to have the right number of people in order to develop something coming close to herd immunity or being able to protect the population. So there's a lot of factors involved with vaccination. The federal government did, with HHS and Department of Defense, come up with Operation Warp Speed in order to get vaccines up and manufactured. The leading candidates are already being manufactured. They'll dump them if they don't work. They'll have a whole tranche of them if they do work. So hopefully over the course of the spring, we'll have a vaccine and be able to immunize the population. And then last but not least, with regard to therapeutics and vaccination, there is ongoing planning going on right now. On the left is a document from the federal government. It's really a framework that gives some guidance to states in their planning. States are actively planning. The document on the right is the state's vaccination plan, how they're going to distribute the vaccine. I think the federal government is honing in on a prioritization scheme with who would get vaccines first, and these will likely be frontline healthcare providers, the elderly, and those people who are the most vulnerable due to medical conditions. But the actual logistics, it's going to be up to the states for how they're going to do that particular distribution. So it's a good sign that states are planning. There's be more to come with regard to this. So until we have really good therapeutics and a vaccine, we really have to rely on non-pharmaceutical interventions. You know, masks have been shown to work. They are effective no matter what anybody says. If everybody wears a mask, it would reduce the number of cases. It significantly reduces the transmission. It doesn't prevent it entirely, but it significantly reduces that. And social distancing is very important. So subject to your questions, I thank you for your attention.
Hi, Terry. Yeah, we actually do have one question from Mario Giacomia. He says, as we move to the winter season, could COVID and the flu overwhelm the healthcare system? And can a person get both infections?
Sure. No, great question. Thank you for that, Dr. Giacomino. Yes, you can get both infections. And if we were to look at the Southern Hemisphere, their flu season, like Australia and other countries, they had a significantly lower number of flu cases than they have in past flu seasons. That could be because their flu season coincided with the start of the pandemic, and a lot of people were, locked up inside, weren't going out. That could be, a large part of it. So it really remains to be seen how flu is going to, affect us during this third surge. It seems likely that, as kids are staying home, I think there's some variation across the country with regard to that. They're the little flu spreaders. And, we just need to make sure that we get as many people vaccinated as possible. I know the federal government added a couple 100,000 more doses this flu season. And the goal was to get as many people vaccinated by the end of October. So get your flu shot. So I think the answer to that question is in this country, but it remains to be seen whether or not that'll happen. I do think in a lot of places, our healthcare system's already overwhelmed. I mean, if you look at the Dakotas, Idaho, Minnesota, Missouri, even Texas is now starting to become overwhelmed in some places. We are overwhelmed with COVID. So flu is just not going to help it anymore, so.
Thank you. Another one from Laura Callis. It says, it looks like the most vulnerable communities have been the Black and Hispanic ones. How can we ensure they will be prioritized with the vaccine?
That's a great question. And the people who are doing the prioritization have had those discussions on how you protect the most vulnerable. And it's my opinion that one of the ways that you do that is that those individuals who are in frontline types of professions, especially where Blacks and Hispanics are disproportionately affected, should be in that first group of people who get vaccinated. I mean, people who are grocery store workers, healthcare workers, all those things that are considered critical infrastructure that we have to keep going, and they should be at the front of the line. And I think what'll happen is because Blacks and Hispanics are disproportionately in those frontline jobs, they would tend to be vaccinated. Now here in Florida, interestingly, the zip codes that were affected in Palm Beach County tended to be those areas where there were a lot of farm workers and Guatemalan refugees. So, I think we also need to think about those critical infrastructures as well, farm workers and others that are very vulnerable. So.
Okay, thank you so much. Now moving on to our next speaker, which is Mary Dunning.
Hi, thanks so much for that great presentation, Dr. Adram. Right now, I'd like to remind you all that we have some great auction items up for bid. And Marcos is going to put that link to the bidding website in the chat box here to share with you. You can go and take a look at the great items that we have up for auction. Of course, funds raised through the auction help us continue our work here at Caridad Center, keeping our doors open and services flowing to those who need us so much. We've got some great items here: virtual cooking lessons for up to 10 people, an outdoor 4-day, 3-night stay, golfing, skeet shooting up here in Central Florida. It's the real Florida there. It's beautiful. And a offshore fishing charter for up to 6 people that departs off of Boca Raton, and an incredible package of 12 bottles of Tuscany red wine with very high critic scores that would make a great Christmas gift. So please, would you get a chance, go to that site and take a look at those items. And also, you can also make a donation to Caridad on that same site. Thanks so much.
Okay, our next speaker is Dr. Michelle. Dr. Michelle is the founder of Larkin Health Systems and Larkin University. For the past few years, Larkin has been sending ophthalmology residents to volunteer at our eye clinic. Dr. Michelle has also served on our Carter Hardball Committee for the past 2 years and is a major sponsor of this event, which is our most significant annual fundraiser Caridad holds each year. Please welcome Dr. Michelle.
Thank you, Scott, for the opportunity to speak to everybody about this important subject. I'm going to start sharing my screen. I wanted to first start by maybe not making you feel so bad over there in Palm Beach County. These are the numbers in Miami-Dade County as far as admitted patients to hospitals. And you can see there's about 100 more patients in the hospital, compared to 10 days ago. And these are the rescue calls. These are Miami-Dade County fire rescue calls for people with suspected COVID diagnoses. So this is obviously, we're starting to see an increase again, which is concerning. The way we, started in this project was we were involved with molecular testing for myocarditis, for viral myocarditis, and with some collaborators in the Charité Center in Berlin. And basically when people have this viral infection of the heart, which actually COVID happens to be a cardiotropic virus that causes that. Basically what happens is you present with a flu-like symptom, and a few weeks later, you're in fulminant cardiorespiratory arrest, or your ejection fraction could be as low as 10%, and you could end up being in a transplant list. Most people get better, and then some people progress to either death or heart transplant is one of the causes for heart transplantation in this country. And in Germany, what they do is they actually do a biopsy of your heart to find out what kind of virus or whether it's an inflammatory process, and they have different protocols depending on what the pathology shows. In cases where it's the active virus infection, you treat with antivirals or different agents, depending on what the virus is. And then if it's an inflammatory response, then you can use steroids or interferon or other types of therapies. And we had a patient that we sent over there in his 30s. And then subsequent to that, he kind of convinced him to start a lab down here. That's how we got into this molecular viral testing. Right around February or so, they told us that we should get involved with high rapid testing. And so we acquired what they call the Panther Fusion. It does about 1,200 COVID tests a day. This was before the CARES Act and all that stuff. So we started doing a lot of testing. And as a result of all the testing we did, we started having this problem. What do we do now with these test results? Obviously, the health department back then, there was not much going on as far as ability to follow these people or track them. I remember the first day we did testing, we had, I think it was like a 20% positivity rate. But what was most alarming was like the fact that, the stories behind each of these cases. We had a gastroenterologist who had been working in the office for several weeks seeing patients, and he had this nagging cough, and he didn't think it was anything. There was a nurse that had been working in ICU at a local hospital, also with the nagging cough, was told, don't worry, it's probably not COVID. This is back when testing wasn't even available. So, we started trying to figure out, well, what do we do with this information? How can we help the state? And so we came up with the ASHTO, Association of State and Territorial Officials, came back with this course called Making Contact, which is basically a free course for contact tracing. We started recruiting medical students throughout the country who had been the international students and foreign medical graduates got kicked out of their training because of COVID. And so they were kind of, sitting around doing nothing and asking for opportunities to do remote rotations. So we said, how about we train you to be contact tracers? And so we developed a process for training them using the course. Then subsequent to this, Johns Hopkins came back with a course. And then we approached ASTO about translating the course to Spanish and Creole language. And so as a result, you know, so far we've had about 1,500 contact tracers in the US trained, and about 2,000 in Latin America trained. And show you some of those statistics. Give me 1 second. I have to stop screen sharing for a second. And so let me screen share again for a second. This is the course that was translated to Spanish, and this is Creole. Not many people have taken the course, but you can see like 3,000 people here in the Spanish course, and 2,000 people have actually gotten the certificate. And the interesting thing is the countries, right? That this is basically most Latin American countries, but you see there's a spike here in Ecuador. You're probably wondering why. And I don't know if you remember, but Ecuador and Guayaquil had one of the worst outbreaks in the Western Hemisphere. So far we're most 1,300 people trained in Ecuador in contact tracing. And so, you know, we get kind of close to them and about kind of learning what they did and how they approached it. This is Guayaquil, which is in the coast of Ecuador. They had about 800 deaths a day. They went up to 800 deaths a day, the height of their peak. And their peak was a result of, you know, travel from Spain. And you can see, you know, the way that their holidays were structured. You know, they had these holidays where people came back from Spain. Then they had, you know, early February, they have Carnival. And then they had, you know, religious holidays. And all of these things contributed to basically the virus coming out of control. So they had 800 people dying. They didn't have places to bury them. I don't know if you must have seen the pictures of people not being able to put their loved ones in coffins. Bury them. So they would basically put them in a coffin and then put them outside the house because they were superstitious about whether they could get, they could have a dead person in the house. And so you would drive by the streets of Guayaquil and you would see basically coffins outside of most houses. So it was devastating. And they went from this to basically having 0 deaths for like a 45-day period. So when they approached us about the course, we were like, well, we kind of want to know what you guys did because it sounds like you really did a good job. And so we came across this 32-year-old architect who basically decided to hack the 911 system. And so he made these maps of where the 911 calls were coming from for respiratory illness. And also when people were called because people had died and they wanted to pick up a cadaver. And so he made these maps, and basically what he did is that he made an invisible enemy visible. And with this information, they were able to go into these areas. It turns out it was areas where there was a lot of people concentrated, high poverty areas. Interestingly, we just talked about Black population in Palm Beach. It turns out that their Afro population is like somewhere around here. There's absolutely like no COVID activity there. It's unclear why. I mean, no COVID admissions to hospitals. They get COVID, they have a minor illness, and they somehow recover. And these are basically Afro-Equatorians. Unclear why, but you know, they take this special diet where it's based on garlic and vegetables. It could be something genetic. We don't really know. We had thought about offering to do some sequencing just to figure out why they were so protected, because everybody around them dies. It was like basically most of them are poor, so they're working in the streets and they're out there giving the virus to everybody, but they don't get sick or not get sick enough to end up in the hospital. So, you know, with this, the other interesting thing that Ecuador did is they came up with this application called Equavida. And basically what Equavida is, it's a COVID risk evaluation. So the idea is, you know, the reason contact tracing has failed in the United States, it's because 3 reasons. I don't know if some of you may have seen the article in The Atlantic recently. And so number 1 reason is we have too many cases per day. So we have 70,000 cases a day. So to contact trace someone appropriately, because remember, you're sitting with somebody and you're trying to get back to them remembering what happened a week ago. or who they were in contact with. And that could take a couple hours. So imagine multiply 2-3 hours times 70,000 people, which was yesterday's number in the United States. You need an army of contact tracers. That's why they say that, you know, contact tracing is the largest civilian mobilization since World War II, because it's what worked in Asia. If you look at Hong Kong and if you look at Korea, South Korea, basically they had no cure for COVID. They just basically contact trace people. And the United States would need, you know, they're saying 30 people per 100,000. So it should be approximately 100,000 people. But if you want to do what China did or what Korea did, we're talking about probably 60 people per 100,000. So we're talking about 200,000 contact tracers. I think the closest we are right now as a country, it's probably in the 50,000s. And that would be, a very optimistic estimate, probably less than that. And so the number one reason is we have too many people getting infected. Number two reason is it takes too long to get the lab results. You heard the stories about how long it takes to get lab results sometimes. So, you know, this is a virus that's very highly contagious 2 days before symptoms and the first 2 days of symptoms. So if it takes 7 days to get the lab results, you can see how contact tracing may not be very effective because the virus kind of has already moved on to the next 2 or 3 people. The last reason why contact tracing hasn't been effective in the United States is because, you know, we as Americans don't really trust government. So, you know, if you look at the results from even the few contact tracers we have, the relatively few contact tracers we have currently working, they report that only like 15% of the calls actually get answered. So that's another reason why we failed. So, you know, the Ecuadorians came up with this. Let me see if I can access it. But basically, this is you know what? It's asking me to confirm. Never mind. Basically, this is a risk app. And what they did is that they came up with an algorithm that looks at symptoms and let me see if I can do it. Looks at symptoms and looks at medical history. Yeah, it's not allowing me to, but so basically you put in your symptoms, you put in your medical history, and it tells you the risk of COVID. So they've done this with like hundreds of thousands of people, and they were able to basically direct these people to a doctor who basically does the contact tracing and the options as far as, you know, what to do as far as treatment. And that worked really well for them. Basically, you're avoiding doing the PCR when, you know, or waiting for the result of the PCR. You start contact tracing immediately. You know, when we talk about contact tracing, you know, there are parameters that we have to follow. You know, it's not just calling somebody. So there's actually an art to it. So, you know, the time to interview. So this is how you measure the effectiveness of contact tracing. Time to interview from symptoms onset and from diagnosis, how many people are interviewed, the median number of contacts that you elicit. I mean, if you just call people and you don't get any contacts, obviously you're not doing very effective contact tracing. The whole point is to identify people that could have been exposed so that they could be quarantined. The proportion of people with no contacts elicited, also contact notifications, another big one, the proportion of contacts notified and the time it took to notify them. And also the follow-up, you know, how many people are being evaluated and how many people with symptoms evaluated within 24 hours of the onset of symptoms, and what proportion of them complete their full self-monitoring period, which is basically that period of 10 days per the CDC. So we developed this app called COVID Fighter that basically tracks their symptoms, looking particularly for shortness of breath as a reason to go to the hospital. Some of you may know, you know, about 2,000 people were found dead in New York City the first few days of April. The reason was probably because of COVID. And so it starts with this, you know, small symptom of shortness of breath where you're not normally short of breath, but you get short of breath when you walk to the bathroom, which is not normal for you, or going up the stairs, and you start noticing that it's harder to breathe. And then the next thing that can happen is that you just don't wake up. So that's why it's important, you know, to measure oximetry. We learn a lot, obviously, since the beginning of this disease and at least educating the population. But this particular app kind of helps them with that. It's a free app. So Contact tracing efficacy is basically the percentage new people, new COVID cases that arise among the contacts. Because if you're still having positive cases among the contacts during the self-monitoring period, that determines your effectiveness. That's pretty much all I had. I'd love to entertain some questions.
Please feel free to send me questions if you have any. I'll give you 1 or 2 minutes to complete that. Thank you. Hey, Jack, so we do have one question, and the question is, how prevalent is contact tracing in the South Florida area, if you happen to know?
Yeah, it's hard to tell. I can tell you it's changed since 4 or 5 months ago. I mean, there's definitely more calls going on right now. We know because we test people. And so we have volunteers call. So we have volunteers call. I think the mistake that we've kind of made is that, we're kind of relying on government. So, the way that most states are handling it, including Florida, is that they're basically hiring people to do this. And I think using university students for this, especially if there's a delay with the vaccine, which may happen, this is kind of the only thing we have. So I don't know how effective it is right now. I do know that people are getting called more than before. So when our volunteers call people, usually they get a call from the Department of Health within a normal period of time. Before that, when there was basically no contact tracing going on back in March, we were kind of doing everything. But yeah. So there is some contact tracing going on. I'm sure you all know it's usually the duration of this, as part of CDC recommendations, that you're supposed to isolate for 10 days. We call isolation is for sick people that have the virus. Quarantine is for people who are healthy, who got exposed to somebody who was positive, but are still healthy. And for quarantine, it's 14 days from the time of contact. And the reason for that is that this virus can take up to 14 days in incubation.
Yes, I'd like to introduce the CEO to Caridad Center, Laura Callis, who will spend a few minutes sharing with you some of the wonderful work that Caridad has been doing for the community during the pandemic.
Hi, everyone. I hope you all can hear me. I think I am unmuted. Thank you. My name is Laura Callis. I'm the CEO here at Caridad, and I want to thank our presenters for such excellent information and sharing that with us today, especially all of this up-to-date information, and also, from an international perspective as well. We don't usually see all this, and I really appreciate that. Here locally at Caridad Center, we had, just like everybody out there, went into a swift emergency mode. And so I'm just going to share with you very briefly how we responded at Caridad, being a public health organization, being a free clinic. As you all may know, we are a free clinic. We serve the uninsured, working poor in Palm Beach County. And so what we did in the very beginning was cancel about 2,000 patients a month. And we went through our electronic medical records and queried out about 1,500 of our most vulnerable patients. Those are the ones that had underlying health conditions, and queried them out and began prioritizing what visits that we had. Whoops, hang on a second here. Okay, prioritizing the visits that we had with those that were in most need of medications and needed to be seen right away. So we ended up, after 2,000 a month, we ended up with about 1,500 patients. And we saw them until we closed down. We only closed down for 2 weeks. We closed down fully for 2 weeks. And this was back in March. Okay, so what we did in the meantime was to set up an emergency car loop. And you can see in these pictures here, we went through our dispensary and we prioritized those medications. Most of those were for our chronically ill, the diabetic, hypertension, hypoglycemic, all of those that needed medication. And with the governor's emergency order, we were able to give them a 3-month supply of medicine. So we began distributing medications through our car loop. And that quickly went into distributing also food, diapers, PPE, a whole range of services that we needed to get out there, a whole range of products that we needed to get out there to our community. We did not have PPE at Caridad Center initially enough to adequately protect us. And we did not have COVID tests. They were very difficult to get. So we partnered with our community partners, Found Care, who was able to secure a large number of testing. And we gave them manpower, and we went out together into a number of different communities and began testing in those communities. We did 3 different community events, and one we did at Caridad Center, one we did with the Guatemala Maya Center in Lake Worth, and the other we did also in the same city of Lake Worth because we began to see a hot spot there. And interestingly, the one we did at Caridad Center was about a 12% positivity rate, and that was in April. By May, when we went into the Guatemala Maya Center community, we were seeing a 21% positivity rate there among those people. And again, at Caridad, for patients also that can't come from the city of Lake Worth and are Mayan as well as other Hispanic nationalities. So we were seeing clearly a really high level, always higher than the county averages among our communities. And again, our community are those that are working in the fields. They are working in landscaping, construction, restaurant, hospitality. And so many of them became frontline workers, the essential workers that were helping keep our community going. Some of them behind the scenes in the fields and farms, and other ones directly in grocery stores and so forth. And what we're finding with those communities, with our communities, was that they live sometimes 3 families deep in their homes, and so they cannot effectively quarantine. And even those that were testing positive were having a very difficult time isolating. So what we did, as soon as we began to acquire PPE and tests ourselves, we set up a mobile car testing loop in Caridad Center as well. So on one side of the center, we had medication distribution and food and diapers. And on the other side, we did mobile testing for COVID-19. So in all, we tested over about 750 people. And we had an average of 16%. And that's averaging from April through till now. Even now we have, I think our lowest rate was 9% when the counties was at a 3 or 4% positivity rate. So, understanding the nature of our community and the challenges that they present, having to go to work. They don't have the savings, they don't have the privilege of working from home and taking that time off. So we could not wait on the county to do the contact tracing. It wasn't quite working. So we took the Johns Hopkins training that Dr. Michelle mentioned, and we had we trained about 20 of our community health workers on the Johns Hopkins contact tracing model. And then we pivoted our case management program to create a virtual COVID positive case management. And so we assigned community health workers to those who tested positive, who contacted them every day. We did medication and food drop off, as you can see here. Many of these families were having a very difficult time with food and medication and other services, and we wanted them to stay home and stay safe. We also delivered them PPE. Here in August alone, we delivered over 980 meals to our families that were either quarantining or were socially isolated. A huge need is for emergency assistance for rent, utilities, formula, diapers, and other supplies. You know, Palm Beach County received $260 million for COVID relief, but many of our patients were not eligible for that relief. So, and it's not just because of legal status, although that money was only restricted for people who had legal status in this country. So we know that we have an underground economy in Palm Beach County of workers who are out there trying to provide for their families and may not have legal documentation. But aside from the lack of legal documentation, many of our families don't have the paperwork that is required to access some of these safety net programs. They don't have access to paycheck stubs. Many of them could be working under the table. They don't have bank records. They don't have all of this information that's required with their language challenges as well. And so even just getting them access, if they're eligible to these safety nets, has been a humongous challenge. So Caridad responded with our amazing donors and our amazing foundations that have been supporting us to help alleviate some of that. Again, also, we had, I think 40% at one point of our positive cases were asymptomatic, and they were continuing to go to work and continuing to move about into the community, not really understanding the risk that they were placing their family members and others. And even if they did understand, some of them were just up against a wall financially where they needed to work. So we are partnering with Palm Beach County at this point now, and we are partnering to assist their contact tracers. We have 4 community health workers assigned to the hotspot area of Lake Worth. And so our community health workers are contacting those patients that are being tested through the county and are trying to link them to the county's contact tracers. And we have a 66% response rate. So we are very pleased that now that the Palm Beach County's contact tracing program has improved, we are helping to bridge that gap in communication between the marginalized community and those contact tracers to do that. And also as well provide them education and personal protective equipment to protect themselves. And with that, Caridad has resumed our operations. We are open Monday through Saturday at Caridad, although we are at a reduced capacity like everyone. We have increased our telehealth programs, both in our medical departments and our dental departments and behavioral health. So we are really pleased and grateful for our volunteer providers and all of our community partners that have come together to really provide care for our community. Thank you.
Thank you, Laura. If there's any questions, please go ahead and send them in the chat. I'll give you 2 more minutes. Thank you.
Hi, Laura. Thanks so much for that great overview of what we've been doing here at Caridad Center. Really proud to be associated with this organization. Every day I come to work and I see all of our patients waiting to get in, waiting for care, and our employees with their PPE on, helping them receive the services that they desperately need. And that's all made possible by you, our supporters, who keep our doors open and services flowing to the working poor in our community. So please, if you could at this time, give us a donation and support our work here at Caridad Center. It's the only way that we can continue to take care of this Hispanic community. Thank you so much.
Okay, thank you, Mary. I'd like to bring Dr. Giacomino up one last time to introduce our third and final speaker, Dr. Garcia Faju. So, Dr. Giacomino, please introduce our third keynote speaker, please.
Thank you, Scott. So I had the opportunity to attend this talk by Dr. Garcia Faju, where he discussed the impact of the pandemic on the economy of the United States. And I asked him if he would be so willing to talk to us today, and he graciously accepted. I want to introduce him. He's an associate professor in the Department of Finance at the College of Business here at Florida Atlantic University. He received his PhD degree in business administration from the University of Missouri in Columbia. He has he teaches at the undergraduate and graduate level here at FAU, and he has published a significant number of papers in finance and other journals. So I want to thank Dr. Garcia Faju for presenting to us, and welcome.
Thank you very much. And first of all, thank you to Caridad for the amazing work that they do, even more so in these tough conditions. So it's really a privilege for me to be here presenting about the impact of COVID on the economy. So I'm assuming that you all can see my screen and can hear me. So again, I'm going to talk about the impact of COVID on the economy, which is perhaps the other side of COVID. And of course, it's not as important as treating the illness and preventing it. But it shows that people are being affected by COVID, even if they don't get ill. So that's going to be clear across the different slides that I'm going to show. And I'm going to just highlight, I have several, so I'm just going to highlight from each one maybe a particular aspect that I think it's important or interesting to me. So this first slide just shows the waves of COVID that we've seen, whereas like at the beginning of the third, and it looks like initially the COVID affected mostly urban areas, and then over time it spread out to more rural areas and maybe the west of the states. So it's now everywhere, and it doesn't look like it's getting better, of course, right? And it has had a tremendous negative impact on the economy. Unemployment went up dramatically in March, April, when the COVID started, the pandemic started. It's come down a little bit, but really very slowly. The situation is really very bad. A lot of people are unemployed. A lot of people are actually increasing debt, businesses and households, just to make means end, because maybe they've lost their jobs or they want to maintain their business open. They're using debt, and consumption has gone down. We're afraid to go out and it's not safe, so we're spending less. The impact, of course, has actually varied across states. So we take the 50 states in the US and we put them in 4 groups based on how badly they were affected by COVID in the second quarter of the year. And so like the top quartile is the states that were the least affected, and the fourth, the ones that were the most affected. Then Florida is in the second group. So things are bad, but maybe they could be worse, or at least they are worse in other states. So it provides maybe some perspective. But the effects are bad, and they are bad everywhere. It's not just the US, it's all around the world. It's actually expected that the economy is not going to come back to what it was at the beginning of 2019 until the end of 2021 or 2022. That's for the US. Other countries are going to take maybe a little longer. So it's going to take at least next year. That's the prediction as of today, let's say. All the information is like from public sources. Everything I'm showing is from either the Wall Street Journal or the Economist or other public sources. So the situation is bad. It's affected all countries. How about the stock market? Well, initially the stock market appeared to perform really well, unexpectedly so. But really, it's mostly technology companies. So this index is the NASDAQ, which is dominated by technology companies, which have not been affected. Actually, they're the only ones who've been positively maybe impacted by the COVID. We can see here that energy, industrials, consumer discretionary, they were really badly affected by COVID. And then utilities, technology, healthcare, not so much. So the stock market appears to have done well, but it's really a small group of companies that are doing well. The rest are not. And over the last couple of weeks, we've seen that the stock market is actually performing poorly. And part of that is because what's been sustaining the economy and the stock market are monetary and fiscal policies. So if it looks like there's not going to be any more support, that's sort of bad for the economy, bad for the stock market too. And that's kind of where we are apparently as of today. The market's going down today, even though everybody agrees that federal debt is very high already. It's projected to increase even more so, not just in the US, but in many other countries. But it looks like that is the best that we can do given the situation. Use monetary, fiscal policies to support the unemployed, support businesses, support the economy in general. Across sectors, the impact has been also, as I mentioned, differently across different sectors. Restaurants and bars, they were really badly affected. Professional businesses, and then at the other end, utilities, financial activities, technology, they haven't really suffered as much. So it's really some sectors that are really suffering more than others. And these are sectors that some of them are particularly important in Florida, in South Florida. However, there are reasons to be optimistic. If we look at some very recent data, for example, for orders by companies, they have increased, right? They went down dramatically at the beginning of the pandemic, and subsequently they have actually increased. And in the ones for September were actually higher than the previous one. So these companies appear to be actually increasing their inventories because they expect that there's going to be demand, and they want to maintain that, or they want to be able to actually satisfy that demand. So that's kind of like a good indication that at least companies are more optimistic than they were just a few months ago. I'm going to highlight some sectors that are particularly relevant also for Florida, South Florida. Real estate in particular has been doing well. It was again, the impact was negative at the beginning of the pandemic, as it was for everyone. But subsequently, it has actually performed very well, which is good news for South Florida. Same thing for home sales. This is construction spending, home sales, but almost any indicator related to real estate is one of the few maybe positive notes that we can see in the economy. In terms of retail sales, there was this drop at the beginning of the pandemic, but the retail sector as a whole has kind of like recovered somewhat. But if we actually look at the different components of the sector, it's really home improvement, the one has actually driven the sort of like the outperformance of that sector. Groceries are sort of like right around where they were at the beginning of the pandemic, and other sectors within the retail market, like apparel, they're not doing so well. And we can sort of like see that if we go out, right? There are many customers at apparel stores, but however, home improvement, we intuitively or anecdotally know that that has been doing well. In terms of restaurants, the part that out of this graph, the part that I felt was particularly interesting is that it's really the smallest independent restaurants, the ones that are really suffering. Initially, it was all of them, but the bigger chains appear to have recovered to kind of roughly where they were at the beginning of the pandemic. But the smallest independent restaurants are not, and really in terms of unemployment or earnings in general, they're the ones that are actually suffering the most. And to some extent, they're the ones that are counting on maybe federal assistance. Looking ahead, this graph shows kind of what Americans expect to spend during the holiday season. It's based on a Gallup survey. And it looks like at this point, we are planning to spend roughly what we did in 2016, which is not great. We're not going to spend as much as maybe last 2 years, but it could be worse. Right? So we're not kind of where we were during the 2008. But again, this is kind of as of this is a very recent questionnaire. Things may change depending on how the pandemic kind of like evolves over the next few weeks, or maybe the election. Going forward or looking forward a little longer, gold is an indicator of how things may be going. If we see the price of gold maybe dropping, that may be an indicator that people are becoming more optimistic and maybe less afraid of the pandemic. The economy is really doing a little better. Inflation, if we see inflation picking up, which we have seen over the last few months, that's also a good sign. That means that the economy is sort of recovering. So there's a couple of indicators. One that I don't have on a graph is consumer sentiment. That's another one that is good to follow, just to understand where we are maybe gonna be in a few months, or how we're feeling about the economy in general. So that's kind of it for me. So any questions, I'll be happy to answer if I can. Thank you.
Hey, Luis. Yeah, we have one question from Mario Giacomio. He says, we have seen an increase in alcohol consumption due to the pandemic. Do you feel that the trend will continue, and will alcoholism go up in the population?
I mean, I'm no expert on that's kind of like a big issue, and honestly, I'm no expert. But to the extent that the social issues are related to unemployment, we should expect that the situation is not going to improve until the economic situation improves, right? The job market improves, which hopefully it doesn't look like it's going to be this year, but the expectation is that sometime next year is when the economy will recover. So that's kind of what we're hoping for, and there are reasons to be optimistic about it.
What are your expectations for the government to aid in financial needs?
So yeah, so personally, I think it's going to happen. That the apparently from like what politicians are saying, there wasn't enough time for them to actually reach an agreement before the election. So they are blaming it on time. So, but I think it's going to happen because the economy needs it. So whether it's going to be before the end of the year or early next year, or whether it's going to depend on who gets elected or no, it's hard to say. But I think some sort of a stimulus is going to happen, some sort of like financial aid, because the economy needs it. And a lot of people are still unemployed. Long-term unemployment is still very high, and businesses need it. So my expectation is that we will see some sort of a support from the government, which is going to be good also for the stock market. Whenever that's announced, the stock market will probably react positively. One other thing that I should have mentioned is that tomorrow, I think, is when they're going to release numbers from the third quarter. And depending on how those numbers look like, which everybody expects are going to be good, that may also help kind of like the economy or the optimism, consumer sentiment, and the stock market.
Right, definitely. Thank you so much.
Thank you.
Thank you, Doctor, for that presentation. Once again, we need your support here at Caridad Center. Please, if you can, make a donation and check out our auction. We have those items there available for you to take a look at, and make your gift today. Thank you.
Yes, I'd like to thank, first of all of our three keynote speakers, as well as Dr. Giacomino. They were excellent, and we really appreciate you taking time out of your busy schedules to share this valuable information. I know I learned a lot, and I'm sure everyone who attended today's Zoom meeting learned a lot as well. This presentation will be on the Caridad's YouTube channel, as well as you can also find it on our website. And as Mary mentioned, if you could please help us out today by going to www.caridad.org and click the donate button. We need all the help we can get. And thank you again for all of your support.